Hello, everyone. Welcome to This Day. It is Monday, September 28th. Now, we have one meeting to tell you about today, and it is the third Architectural Control and Standards Committee meeting, which will be at 9:30 this morning. And of course, you could follow along at lagunawoodsvillage.com/meetings. Now, let's go ahead and tell you who's on our show today. We have Jeff Parker, who is here to give us a Laguna Woods update. And then we also have Robert Muchnick, who is the treasurer for the Third Mutual, and he will be telling us about the special report and the town hall meeting that they're having tomorrow. Now let's go ahead and give you our resources that we normally do for COVID-19. You can go to covid19.ca.gov, then you can go to ochealthinfo.com, and you can call the county hotline, which is 714-834-2000. You can always go to our website, which is lagunawoodsvillagealerts.com. And if you have any questions, you can email them to info@lagunawoodsvillage.com. Now, our weather is looking very warm this week. We are looking at a high today of 87, 67, very hot tomorrow, 97, 72, even hotter on Wednesday, 99, 71, then Thursday, 93, 70, and then Friday, we are looking at 91, 66. Our sunrise this morning was at 6:44, and the sunset will be at 6:39. Thank you, Lori, for sending in this gorgeous photo of the Caribbean and a nice cruise. So I wish I was in that water. Very nice. If you have a landscape photo of somewhere around here, or maybe you have been on vacation, please send it to lagunawoodsvillagetv@gmail.com. We'll be right back with Jeff Parker. Stay tuned.
It was just a get-together with friends. No big deal. Everybody felt fine. Now, I'm super sick. Everyone is sick. I just wish we had been more careful. It would have been easier than this. So wear a mask. Do what you can outside. Stay 6 feet apart. Because some things you just can't take back.
Do your part to lower the risk.
At Harvard Eye, we're so happy to be open again to see you for all your medical and surgical eye care. We're taking great care to protect everyone from COVID-19 by seeing fewer patients, spacing out chairs in our lobby, sanitizing our office constantly, and doing much more. The world is changing a lot, but what hasn't changed is we're honored by your trust and confidence and committed to keeping you safe. We can't wait to see you.
This crisis has changed almost everything, but not our resolve. We've pulled together, worked hard to keep each other safe. We've flattened the curve and are starting to reopen our communities. We can protect the people we love and help Californians get back on their feet. For our families and our communities, let's stay the course and stop the spread.
Dr. Beto, Doctor of Physical Therapy, and I want to share with you a Medicare program that allows safe in-home treatment. No more crowded clinics, no more waiting rooms. If you or your loved one are suffering from pain, poor balance, strength, or have had a recent fall, we can help. Call Care2You Health now to see if you qualify.
Hiring a realtor you trust is the first step in selling your home. Selecting an escrow company that can safeguard your money and personal information throughout the transaction is the next step. Escrow Options will guarantee the safety of your personal information and funds from the risks of wire fraud and cyber theft. Choose the escrow company that works for you. Escrow Options Group, protecting consumer assets in escrow since 2005.
Welcome back. As I mentioned, we have Jeff Parker here, and we were just chit-chatting before we came back on. And, you know, sometimes a weekend just produces entirely new information, which just, I think, shocking.
Yeah, on Friday when we talked, you know, I said that there were just 50 cases in the community of Laguna Woods, which we're a big part of.
Right.
And then we got the information Friday night, Saturday, that the number had jumped from 50 all the way up to 65. Mm-hmm. And that actually grew another couple cases yesterday and Sunday. And so we're now at 67 cases in the community of Laguna Woods. Mm-hmm. Want to make sure everybody realizes, again, that doesn't mean necessarily the village, although we're 95% of the village, of the community of Laguna Woods. So I think we need to realize that the potential is that we did make contact with the Orange County Health trying to find out if they could identify specifically if it was in the village or not. We did not receive any information back from them as to that. And that's because of the different health and safety laws of telling you where. And we're just generically wanting to understand if it's in the village versus if it's outside the village, not a specific resident. That's what we're looking for.
And you know, and I think, Kate, there's more testing that's going on now, and people are like, you know, I'm going to go get my test just to see. So they're doing that, and there's also going to be a clinic coming up here on Wednesday that's going to be a free COVID-19 clinic, and they'll be able to do testing. So I'm assuming those numbers are probably going to increase.
They probably will, but and like you said, I think testing's critical, and so the more testing and the fact that we have a free opportunity for the residents to go down to the church and get their testing, that's great, and appreciate the county expanding their testing operations. But if you look at the numbers, to see that jump to 67 was kind of like shocking I think, to a lot of people that are following it on the website. So we again are in communication with Orange County Health. Hopefully we can identify whether or not it's in the village more than it's outside the village.
Okay.
And we'll go from there.
Well,
now, relative to the overall program, we're still in the red category, Tier 2. However, if you look at our numbers, they're at 3.6 and 3.1 on the positive cases and the positive percentage. If this stays, the word is that sometime maybe this week, they will be lowered to the next tier, which is the moderate tier, Tier 3, which would be good news because the moderate tier, again, allows the private sector to open up capacity, where they've been limited, like in gyms, to 10% and 25% in restaurants and stuff like that. So this would allow a little bit more activity out there in the private sector, so that'll be good. Those numbers are holding, so that's good. Although we did hear from the state of California over the weekend that there were spikes throughout all the counties in the sense that and so did we see a spike. And that may be contributed to the last holiday weekend. Nobody knows exactly for sure because the lag behind that, you know, is 14 days and then you start seeing the results. So if those hold steady and we don't see a big spike, we're, I would say, in good shape to go to that next moderate level.
Oh, that'd be good. How are we doing in hospitalizations? I haven't looked on that one. I think that was that's a
actually
different
really good. The rates right now are 165. As you can tell with the regards to patient, and more importantly, like I said, that ICU number at 45 is really good. So see, we have a minus 6.8% slower.
Okay.
That 36% availability at the 45% of beds, that's really been going down steadily. So that's really a good
There's
number
that flattening of the curve everybody was looking for, that's for sure. So hopefully we stay on that track and just, you know, kind of have a nice winter.
Exactly.
You know, we don't know what to expect. All right, well, thank you for the updates on that. We'll keep an eye on those numbers to see, and then we'll be back again here on Friday with you to talk about hopefully a lot less numbers.
That'd be great.
All right, so you've got some things to announce. Third Mutual, you know, they're doing a big push now to change CC&Rs and some other things.
Tomorrow afternoon, I know you have Robert Munchak coming up. They're going to have a mutual, Third's going to have a meeting, a virtual meeting to talk about their modernization of their CC&Rs and their bylaws, and that's going to allow them to better serve the community and create one document as opposed to the I think it's 56 different CC&R documents that they have. So he'll talk about that more, and I'll let him get into the details. But it's a good move to at least look at that and and go through the process of making that happen, because it not only from an administrative point of view, but I know from the board's point of view, having the conciseness of here's one set of rules that we can provide our residents, I think that's a really good thing.
Oh,
So
yeah.
I can see why they want to move forward in that direction.
Yeah, I mean, I remember receiving a big CCNR's packet, and it's huge, but if it was as big as the one that they were talking about, that's just insane.
Right, and it's I'm sure it can be
get through that
confusing
many.
depending if
Yeah.
you're live in one area of Third or
Right.
another area of Third, and the common space, and making sure that it's managed appropriately. So
Exactly.
it makes a lot of sense for them to take a look at consolidating them all.
Okay, well,
Absolutely.
excellent, good. And then I understand that there is an electricity, did you call it a supplement? No.
Yeah, it's a rebate basically.
rebate,
It is a subsidized system. So what's happening in Laguna Woods through Edison, the city of Laguna Woods is having a utility subsidy, and that goes. That subsidy basically is addressing people who saw electricity bills go up because they had to stay at home.
Oh, I
So
see.
from
Nice.
March to August,
Okay.
if your electric bills went up because of the fact that you were doing what you were asked to do, which is stay home, the city has a subsidy program that they're receiving through Edison. And the applications deadline for it is October 21st and by 5 p.m. or until funds run out. So what I mean by that is get your application in as soon as possible,
Quick.
because
Yeah.
it is possible that the funds might run out. So it's kind of like get your application in. Again, it covers everybody who had a utility increase or saw an increase between March and August, which was the bulk of that period of time, 5 months that we saw everybody hunkering down, staying at home. So it's a really good thing that the PUC has pushed through to all of the utilities to do this, and the city of Laguna Woods is managing that process.
And what's the website address is cityoflagunaWoods.org/COVID-19 funding. So that's great, and then they can see all the rules and regulations that are regarding that, because it could have age limitations and things like that.
Exactly.
Okay, wonderful. Well, thank you so much. I appreciate it, and we'll keep an eye on those numbers and see you on Friday.
Hopefully we can continue to have progress,
Yes.
at the same time keeping everybody safe out there.
Exactly. Thank you.
Thank you.
And remember, if you want additional information about reducing your electricity, not really reducing, but subsidizing the money that you saw increase, go to the cityoflagunawoods.org/COVID-19 funding. We'll be right back.
SCAN Health Plan is a plan that is truly here for their members.
Members are the most important thing.
When you call us, you'll always get a live person. That live person is committed to you and your particular needs.
We cover your prescriptions, we cover your doctor, we cover your hospital. You only need one plan.
If you're new to Medicare, have both Medicare and Medi-Cal, or have been diagnosed with certain chronic conditions, you may qualify to join SCAN now. To learn more, call SCAN today or talk to your agent or broker about SCAN.
By staying home, the community of Orange County has made a difference. But doing so shouldn't mean putting your own health at risk. Hogue wants you to know that safe, quality care is available. Don't ignore or delay the medical attention you need. From routine checkups to revolutionary treatments, Hogue is here for you, just as we have been for almost 70 years. Like no other time before, your healthcare choices matter. Get the care you need from the name you trust.
Hi, I'm Vince Ferragamo. I spent some of my best years as an NFL quarterback, but today I've got a new team, and we're helping seniors who spent their best years fighting for our country, defending our freedom, and informing the nation. Our hometown heroes need help. AgeWell Senior Services is their lifeline. Nonprofit AgeWell can do all of this because you care enough to give. Please join me in supporting AgeWell. Donate today.
Parkinson's disease is a neurological movement disorder affecting an estimated 1 million Americans, including many under age 40. The American Parkinson Disease Association is the largest grassroots network in the United States, working to help ease the burden and find the cure for those coping with Parkinson's. Visit apdaoptimism.org today to find out how you can help millions live with dignity and optimism. Your action today will help APDA put an end to Parkinson's disease.
Welcome back. Well, as I mentioned before, we have Robert Muchnick here, who is with Third Mutual, and he's here to tell us a little bit about a special report. And I know we talked a little while ago regarding the budget and what's happening with insurance. And so thank you for being with us today.
Well, thank you, Lisa. I'm glad to be here. As you've heard, Third Mutual has a pretty serious situation on our hands. It's one that requires all of us to come together and support the upcoming ballot proposition with a vote of yes. Otherwise, it's simply an untenable dilemma. I'm the treasurer at Third Mutual, and I can tell you the numbers are not looking good. We've got to understand that we are at a very serious tipping point, with all the weight coming right now, today, from our exponentially rising insurance costs.
Right, right. And now I know that you are going to have, there's going to be a meeting tomorrow, the town hall meeting, and you guys are going to be discussing the insurance requirements. And that is at 1 p.m. tomorrow, correct?
Correct. And the public can watch via Granicus if they want. Okay?
Right. Yeah, and then they can do that, and then we're also going to be having it live here on Village Television starting at 1, and then we will have a rebroadcast at a later time, so for those people who couldn't see it.
Thank you. Yeah. That's great. And we really appreciate the support TV6 has given us on this. All right, let's talk about insurance. When last time I was here, we talked about what we had budgeted for insurance, and you can see by the chart, I've added a column this time. If you watched last time, we had all the way up through the 2021 budget column, and now I've added the actual premium for 2021 that we will now be binding as of October 1st.
Okay.
And you can see we budgeted, for example, for hazard and liability premium, we budgeted $695,000, and the actual premium is $716,000. On the positive side, we budgeted $125,000 for D&O liability, and it came in at $85,107. So that was a positive. But now we get to the really negative. The property premium, which is the bulk of our insurance for the village, actually for Third Mutual, because that's specifically what we're talking about. You'll notice that the annual premium in 2020 for $700 million was $1,413,000. And that was with a $10,000 deductible. Okay? We budgeted this year $3,087,000. And the reason we budgeted that, as we discussed the last time, was because the evaluation of the village went up. Also, the number of wildfires in the area has increased, all driving up the cost of our insurance. So we budgeted $3,087,000. Sadly, the actual premium for this year is $4,147,000, and that's with a $25,000 deductible. So if you see in the bottom right-hand corner of the chart, our total premium this year is $4,949,000, up over $1 million from what we budgeted.
Right, right. And that is only for the $700 million valuation. Wasn't there an assessment of something higher?
$1.6 billion is the assessment for Third Mutual.
Wow.
All right, our brokers have been very clear. Number one, we can't get $1.6 billion. They don't even think we could get $1 billion of insurance.
I see.
So we're insuring at the same amount this year as we insured last year.
I see, okay.
Okay.
All right, I got it.
All right, the next slide shows something even more problematic for the members of the village. And they need to understand a number of things, especially if you live in Third. First of all, as you can see from the top left-hand corner, we increased the monthly assessment per manor $20, and a lot of people were very upset by that. However, we had anticipated that there was going to be a $44 increase per manor per month. We cut it to $20. We took an additional $24 out of reserves. That was our plan. However, because the actual cost of insurance is so much higher, we're taking an additional $48 per manor per month out of our reserves to cover the shortfall in the insurance costs, okay? We project for next year, now here's really where the problem is. In the past, United and GRF have always partnered with us in terms of getting the insurance, the $700 million. United is in a very different position. They're not required to have 100% replacement value on their insurance. So they want to buy this year less than the $700 million. They also have indicated to us that they want to opt completely out of the relationship we've had currently because they want to go a very different direction in terms of their insurance.
Okay.
If that actually happens, we will have to then pick up the full amount, let's say of another $700 million for next year. That would mean another increase of $46 per manor per month. So if you take the $48 per manor per month that we're covering now out of reserves, and then you add the $46 per manor per month, the potential increase for our members in Third Mutual could be as much as $94 per manor per month. All right, because our total insurance for next year, as you can see in the bottom right corner, is going to be $8,350,000. This year, it's $4 million and change. So you can see it's doubling if United goes a separate way.
Okay.
All right, so that's what we're facing, and that's exactly why we need to have the vote on the CC&Rs. We need to have people support the vote on the CC&Rs. And there's going to be, as you said, the town hall tomorrow, which is going to allow all the members to call in, ask questions of the board members who are involved in this.
Right.
The CC&Rs will be published online for everybody to have access to, and that's where we are with the process.
Yeah, it's just amazing the amount of insurance, how it's just doubled like that. That's crazy.
Well, remember, the value went from $700 million for Third to 1.6, so that more than doubled the value. And then you add in the increases because of the wildfires, and it's become a seriously problematic issue for us.
Now, on the ballot, will you be discussing tomorrow the proposition number and things like that that they will be needing?
Well, tomorrow we'll be discussing the CC&Rs. They'll be getting a copy of the ballot in the mail. It's going to be mailed out October 2nd to every member, and they'll have information, there'll be flyers, things of that nature.
Great.
There'll be the town halls. This is the first town hall tomorrow that you folks will be running live for us.
Okay.
And there'll be a number of other town halls that we'll have as well.
Okay, well, excellent. Now, there is another slide that I wanted to share, which is an email address that has, you can send an email to nomessvoteyes@lagunawoodsvillage.com if you want additional information, or as Robert mentioned, you can call 949-354-4199.
Right. So as you can see, it only makes good financial sense to vote yes on the ballot proposition. So look for your ballot October 2nd in the mail. You'll have until October 29th to mail it back. Or if you want to hand deliver it, you can hand deliver it to the community center, but it has to be hand delivered no later than November 2nd at 5 p.m. So thank you very much and appreciate your support.
You're welcome. And then one note on the community center, will there be somebody outside that will have that?
There'll be a box outside.
A box, okay. All right, perfect. Thank you again.
Okay, thank you.
All right. And remember that tomorrow at 1 p.m. right here on Village Television, we will have the virtual town hall meeting where you can hear all about the new CC&Rs. We'll be right back.
At our new Memorial Wave Imaging Center in Laguna Woods, formerly Orange County Diagnostics, you can expect the same precise imaging, multiple modalities for your imaging needs, and the same friendly staff with medical providers like Dr. Syed Sharakni. The Laguna Woods Transportation Service offers convenient access right to our door, and we continue to provide the care and compassion that you expect from our new Wave Laguna Woods location.
For the sweaty faces and the hidden smiles, the foggy glasses and the sore ears, the determined looks and the muffled laughs. A simple piece of fabric makes a big statement. I care. Let's all do our part to slow the spread. Wear a mask. Learn more at covid19.ca.gov.
Our movie for today is Apollo 13, and that stars Tom Hanks, and it looks like a really great movie. I know it's all about the Apollo 13 landing and how that all went about. So you can see that today at 2 and 6 p.m., 2 with subtitles and 6 without subtitles, and that is sponsored by Harvard Eye Associates. So check that out with Tom Hanks. Okay, let me tell you about one other thing. We did mention it earlier. The Orange County Healthcare Agency is providing a free drive-through COVID-19 testing for Laguna Woods residents. It'll be September 30th, 9:30 a.m. to 4 p.m. at St. Nicholas Church. And if you would like to do that, you can register at oc.fulgent, Fulgent, genetics.com. So make sure you register with that. All right, let's take one last look at our weather. It is going to be very, very warm over the next few days. So you definitely want to make sure that you wear your sunscreen, keep shaded, and stay hydrated. 87, 67 today, tomorrow 97, 72, very, very hot on Wednesday, 99, 71, and then 93, 70, and then 91, 66. So as the weekend approaches, it is going to be slightly cooler, but we still are looking very hot this week. So stay hydrated today, stay in the shade, and stay healthy. We'll see you again here tomorrow at 9 a.m., or you can watch our rebroadcast at 12:30 and 5. Bye-bye.
Tip, toss, take action. Don't give mosquitoes a fighting chance. Don't give mosquitoes a fighting chance.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
We consider hearing to be an essential part of your life. During this time of quarantine and isolation, you need to be hearing the best you can to understand how to stay safe and to hear your friends and family. Advanced Ear Care is offering service to everyone that needs help with their hearing aids, no matter where it was you purchased. If it's not working properly, please call for a free troubleshooting appointment. We even have hands-free, no-contact curbside service. There's no charge for this service. Advanced Ear Care is here to keep you hearing during these critical days.